Thank you for taking the time to join us today. Yes, and as Angie very rightly points out, sleep is an absolutely, essential and inevitable part of the entire living world. And in essence, it really forms that a part of that cycle of activity and dormancy that every living thing really goes through. Even plants, right? There's a period where they are quiet, there's a period of activity and photosynthesis. So really sleep forms that part of rest that is so important to us. It's really one of the most important activities that we as human beings really perform. It forms a very key pillar of our physical and emotional health. And rightly so, right? Because as popular saying goes, we spend practically a third of our lives doing it. So it better have some purpose and be helpful to us in some way. But the thing to realize and to understand is actually for most of human history, we have actually understood very little about our sleep. And it's always been a topic, a subject that is so core to our human history that it has sparked so much of human imagination. It has inspired, throughout our history, a lot of literature, art, as well as spiritual aspects of human existence. And the painting you see in this slide is an example. The Nightmare is titled, and it was painted in 1781. So for most of human history, sleep has been so core, so central of our existence. But we only in the last few decades have, the science been really catching up. We are starting to know more and more about sleep. But despite the amount of that we know about it, there's still so much that is unknown. There is still so much that so many misconceptions and poor habits that people have around sleep, that really still it still remains a very important topic that so many of us are concerned with. So I hope today's talk I can cover a little bit about what some of these misconceptions or a bit of tips and tricks on how to improve our sleep to share with you all. So essentially, I think we need to start first by understanding what really goes on when we sleep normally or in normal process of sleep, what's happening. And essentially, I think the thing to understand is that sleep is fundamentally a restorative process where we remove, waste products from the body, we replenish, we repair, we regenerate, we build new things in the body. And essentially, a lot of these processes actually range across many different body systems. In fact, all our body systems are very in tune with this cycle of rest and activity, including our nervous system, our immune system, which is very important these days, our musculoskeletal system, bones and muscles, and etc., and gut as well, our heart and lungs, etc. Everything, really is in tune with this process of rest and activity. And very importantly, I'm sure it's very essential to all of us, is actually it plays a very important role in regulation of our mood as well, our emotions, our ability to think, our cognition, and our memory. It helps us process, it helps us to consolidate our memory so that we can function better as the day goes by. And the next point is really that to understand is that our sleep is governed actually by a biological clock. So when people talk about biological clock, it's not just some metaphorical thing that people are referring to, but really we do have an inherent circadian cycle or rhythm that is really biologically wired into us. So much so that this system or this circadian rhythm is really governed by a lot of complex interactions and interplay between neurochemical processes that actually are synced in tune with external signals that we perceive from our environment. So some examples of these neurochemicals, chemicals in the brain, are things like melatonin, cortisol, which is the stress hormone, but it's also a hormone that helps us function when we are awake, and also prolactin, another important hormone that regulates our body systems. And on top of this this circadian rhythm, this cycle that carries us through day by day, we must also understand that the sleep drive, that means the kind of the level of tiredness or weakness that we sense, is primarily homeostatic. And homeostasis is a term we simply use to refer to a balance of sorts. And in the body, sleep is also a balance of rest as well as wakefulness. And just like thirst, if you think about it from a thirst point of view, if we don't drink water for a prolonged period, the sense of thirst builds up gradually until we are so dehydrated and we feel so thirsty that the urge to drink is really strong. And in the same way, sleep works as well. If we avoid sleeping for prolonged periods of time, you will find yourself getting more and more tired, more and more drowsy, you can't concentrate well, and the urge to actually fall asleep becomes really so overwhelming that almost you cannot control it. The other thing is this idea of how many hours of sleep, is important to us. And classically, people refer to this as, the typical 6 to 8 hours. How did this number come about? It's essentially that when we poll the population and we poll across many people, actually the majority of their sleep duration falls within this bracket of roughly 6 to 8 hours. Whether or not it translates into the concept that we must sleep 6 to 8 hours, that's a question that we can answer. Hopefully, I answer down the road by the time I finish the presentation, or we can discuss it a little bit more in Q&A. And on top of the duration of sleep, the quality of the sleep that we get when we are sleeping and when we are asleep is actually equally as important as well. Because if we can sleep 8 hours, we can sleep 10 hours, we can sleep 12 hours, but if the sleep quality is just not there, we are waking up feeling unrested, still tired, not functioning well, it still doesn't constitute as adequate sleep. So a few of these general principles for us to understand first, but put things in context. Next, I want to talk a little bit about a bit more in technical detail, actually what's happening in our brains when we are sleeping. Now, sleep is not just a matter of flicking a switch and shutting down for the night. There's a lot actually that is going on in the brain that happens when we're actually sleeping. And broadly speaking, and I'm sure you've heard that we split sleep into two general phases or two types of sleep. One is called rapid eye movement sleep, and the other is non-rapid eye movement sleep. So REM for short, and non-REM sleep on the other hand. So actually our sleep moves in cycles between various phases of sleep. And in this graph, we call a hypnogram. It essentially just illustrates what kind of phases we go through in a normal healthy adult when a healthy adult is sleeping. So generally, we enter sleep. We don't start dreaming straight away. We go into actually the phase 1 and phase 2 of non-REM sleep, which are what we consider light sleep. And then very quickly, we actually enter the phase 3 and phase 4, or what we call as deep sleep. Now, these phases, phase 3 and 4, the phases of deep sleep, is really what is nourishing about sleep. And we realize that when people don't get enough of stage 3 and 4 sleep, they tend to wake up feeling quite unrefreshed. But we don't spend our entire night in deep sleep. We come out of it back into light sleep, stages 1 and 2, and then we enter the REM stage, and that's where we start dreaming. When we dream, the mind becomes more active, but actually the body becomes paralyzed. It becomes very flaccid and limp. That's a mechanism so we don't start acting out our dreams, okay? So that's why we don't actually start acting out our dreams, but actually our mind is very active. And I'm sure all of us have experienced dreams before. It feels quite real when we are in it. And we dream for a little while. Then after that, we go back into deep sleep for a little while and we come back out. And essentially, this forms the cycle, going from light sleep to deep sleep, then back to light sleep, then to REM, then going back to sleep. So each cycle typically lasts about 90 minutes. And we usually have about 4 to 6 cycles of this kind of, sleep every night. So it goes through a cycle. And early on in the night, earlier phase, the first half of the night, we spend more time in deep sleep. Whereas in the second half of the night, we actually spend a bit more time in REM sleep, or the lighter stages of sleep. And when we finally have enough, our fill of sleep, then we gradually spend a bit more time in light sleep, and then we transition out of light sleep into wakefulness. Okay, and I'm sure all of us have experienced that sense of tiredness and grogginess when we just first open our eyes, or when the alarm goes off and we are starting to wake up. And that is, we use the term sleep inertia to actually refer to that. And actually, sleep inertia is normal. Is normal part of waking up. Typically lasts maybe about 10-15 minutes, sometimes a bit longer. What we do know is if we are too sleep deprived, and if we wake up suddenly when we are in stages of deep sleep, that means we go from deep sleep and then suddenly we are woken up from this stage, from deep sleep straight into wakefulness, sleep inertia becomes more pronounced, and it sometimes lasts a little bit longer, but it can also be normal. Okay, so sleep inertia is a common and very normal phenomenon. Actually, sometimes we also have other common sleep phenomenon, things like hallucinations. I don't know how many of you have experienced before, but we sometimes hear things, people calling out our names, or somebody making an exclamation sound or something like that. You think somebody said something, but actually, when you are in the phases just between, wakefulness and light sleep, that's a time when actually normal hallucinations can happen in people. So don't be alarmed if you once in a while you actually experience that. And yeah, so these are sometimes some normal phenomenon actually that we experience around sleep. And the other thing to know is that actually our sleep duration and quality change with age. You would already know this if you are around any young babies or young children. You will know that as they age, as they develop, they will have different patterns of sleep and different requirements for sleep. All right. And the same thing actually goes through our lives as adults as well. Adults and elderly people, we will also go through changes in our sleep as we age. There is gradually less and less sleep, and there's more wakefulness. So duration and duration of sleep decreases. Duration of REM sleep also decreases in elderly people. And of course, the one thing that I think a lot of us are concerned with, where is the role of stress in terms of looking at this? Stress essentially can be a huge disruptor to sleep architecture. When we say sleep architecture, I'm referring to the pattern that your sleep follows. So some people may have problems entering deep sleep. They spend all their hours sleeping in light sleep, and they wake up feeling very unrefreshed. Or especially stress, one thing is that it tends to kickstart our brains, in the middle of the night. And I don't know how many of you experience this, but the 3 a.m. awakening and start thinking about all your problems, that is sometimes quite a clear signal that, you may be under some stress that you are not actually dealing with, and you may need to kind of think a little bit more about managing that a bit more. Because when we're under stress, essentially the brain is just kept active, and when the brain is kept active, is really raring to go, and it just wants to get started and start working on your problems. And that's when, in the middle of the night, when we like what the graph shows here, sometimes in the middle of the night, it's actually normal to come out of sleep just for a very brief moment. Okay, we do wake up in the middle of the night very briefly. Most times we don't really remember it. We are not really conscious of it, but it's also normal. The problem is when people can't go back to sleep when after these moments of wakefulness. All right, and very importantly, how does poor sleep affect us, right? And what's the effects of poor sleep? And very obviously, the first thing we usually experience is a increase in the sense of sleepiness and drowsiness, and decreased energy for us to sustain us throughout the day. We can sometimes also experience poorer attention. We realize we can't focus as well. We react more slowly, and that's why a lot of times poor sleep causes things like road traffic accidents and things like that. Because when we perceive a threat, we don't react as quickly as we should. And the rest of it, this part, the decreased cognitive processing, flexibility, and moral judgment really reflects that the sleep really has quite significant effects on the frontal lobe of the brain. Now, this frontal lobe is an important part of the brain where we do most of our rational thinking, when we do all our planning. We actually need the frontal lobe to function well to be able to perform and execute our task. So when we don't get enough sleep, there's a little bit of frontal lobe dysfunction, and that affects our ability to process our thoughts, our memories. It decreases flexibility, how adaptable we are to changes. It reflects actually poorer moral judgment, negative mindset, increased distractibility. Our ability to sense emotions also is affected, and that's where it comes in, the emotional regulation part of sleep is also affected. But in lack of sleep also has other effects on the rest of the body as well. So metabolic system, where our sugar level control happens. We have there has been evidence to show that chronic lack of sleep actually impairs insulin resistance. It impairs the ability of our body to regulate sugar. Insulin is to do with sugar regulation. It impairs our ability to regulate our appetite as well. So a lot of people with very chronically poor sleep may have difficulty with weight management. And also, finally, very importantly, the immune system is a very important system in our body, but unfortunately, most of the time it goes rather unnoticed and taken for granted. But sleep has been also shown to increase inflammatory markers in the body. We don't exactly know why, but some hypothesis is that during sleep, we're actually clearing a lot of all these waste material. But if you are not getting enough sleep, then that process doesn't happen, and there's increased signs of inflammation around the body. So these are some very important aspects of poor sleep. Now, I want to spend some time, the next few slides, talking about the causes of poor sleep. And really, one key fundamental thing to understand and keep in mind is that when people complain of poor sleep, it's often and almost most of the time is not because of just simply one factor or another. It's almost invariably multifactorial in nature. So this really presents most times it's a combination of all these possibilities that actually affect the person's sleep. And the top of the list really is medical and neurological conditions. Other medical problems can affect your sleep as well. Very commonly, in the first one we look out for sometimes is obstructive sleep apnea, when you're snoring too much and there's a blockage of your airways during sleep. Chronic pain is a very significant one. People with long-term pain problems, difficulty with pain management, often this disrupts their sleep in a very, very real way. Thyroid disorders, disorders of the metabolic system can keep people up at night. And neurological conditions, right, like Parkinson's disease, dementia, patients often have things like day-night reversal. Their sleep patterns are very disrupted. And so on. So this is a very brief list, of possible medical conditions. A lot of other things. For example, also if you were undergoing cancer treatment, for example, sometimes the process, both the psychological as well as the medical treatment processes in chemotherapy is something that a lot of people struggle with in terms of sleep. And secondly, if you came to a psychiatrist finally for your sleep problems, these are the things that we would this would be the top of the list of what we would look out for. Is there perhaps a psychiatric condition or disorder that is resulting in your poor sleep? So across the range of mood disorders, including depression, bipolar disorder, anxiety disorders, the whole range of them. Anxiety is the top culprit oftentimes in terms of insomnia. So you want to make sure these are not there. Patients with psychosis, like in schizophrenia, are often also have very disrupted sleep, a lot of trouble sleeping. So we do need, when these things are picked up, what we do need to do is to start treatment. And with proper treatment and control, the sleep generally improves alongside the symptoms and the condition as well. Medication use is a very common another area of contributing to poor sleep. A huge range of actually very common medications can disrupt our sleep, including blood pressure medication, steroids, which we take for inflammatory purposes sometimes. Stimulants are another area, and antidepressants themselves some of them can also disrupt sleep. Thyroid hormones can make us quite overactive. Oral contraceptives and decongestants especially. I don't know if you've realized this, but sometimes if you go to a GP for flu, what you get is a combination of an antihistamine and a decongestant. And you may think that actually flu medicine is supposed to make you drowsy, but a lot of times decongestant have a little bit of an activating, stimulating component inside. So it's not uncommon in people who are sensitive to medications to actually have trouble sleeping after they take some flu medication. Now, this is a big one, substance use. And I'm not referring in this case to, really hardcore drug use and things like that, but really common things that are very acceptable in our day-to-day use. Nicotine, caffeine, and alcohol, the big three that are there. And essentially, the thing to understand is nicotine and caffeine are really things that actually keep us awake. Nicotine, some people think smoking is relaxing, but really nicotine does have some stimulating properties. Caffeine is obviously stimulating, right? We use it as a stimulant. And a lot of people don't realize, but actually caffeine is not limited to coffee. Tea has some degree of caffeine, less than coffee, but it still has some caffeine. And a lot of soft drinks also actually have caffeine. So be conscious of what you're consuming. Sometimes Coke has quite a bit of caffeine in it, especially energy drinks as well. So if you translate these drinks into coffees, you are taking actually multiple cups of coffee for each can of energy drink you are drinking. So sometimes these things we are not conscious and aware of it. Alcohol is another area. A lot of people have the misconception that alcohol helps them sleep. It is true, alcohol is a sedating substance. So in the short term, when the alcohol is active in your body, or if you're only drinking occasionally, the alcohol intake is not chronic, it's not sustained, then yes, alcohol has some short-term sedating properties. It's good for sleep, but in the long term, especially if people start over relying on alcohol, they're drinking to excess, and in the long term, that's when their brain's ability to fall asleep, especially when they don't have the alcohol active, is very, very much badly affected. So alcohol is a huge culprit actually in a lot of people, and unfortunately, it's a very common kind of first resort when people find themselves having difficulty sleeping. Sleep disorders then is the final thing that we arrive at. So usually when you come to see us for sleep problems, we'll go through a long kind of a thorough process of really asking you and getting a history on a lot of all these in sequential order. And finally, we will start asking more questions on actually, is there really something wrong with your sleep itself? And primarily, we are concerned with insomnia, which I will go into a bit more detail in the following slides. But a lot can happen to our sleep. Some people actually sleep too much. That can be a problem as well. Parasomnias essentially refer to problems with your behavior around sleep, things like sleepwalking, sleep talking, and things like that. Some people have problems with this as well. It can be very disruptive. Sleep apnea, like I referred to just now, your breathing problems during sleep, as well as problems with your circadian rhythm. And this is one very common one we actually see. The most obvious examples of circadian rhythm disruptions would be things like jet lag, which presumably now less people suffer from, and also shift work. Shift work is a big disruptor of circadian rhythms, especially if you are doing irregular shifts. Like a lot of healthcare workers do, we don't do a night shift all the time. For example, we are doing night sometimes, day sometimes, and it moves all over the place. This is especially disruptive to a person's sleep. A lot of young people actually have circadian rhythm disruptions because they are intentionally and voluntarily delaying their sleep patterns. They are spending their nighttime hours studying, gaming, etc., and delaying their sleep and then waking up very late. And when they want to, and when they start working or they need to start attending early class, they come in complaining, I can't sleep when I want to. So that is an example also of a delayed circadian rhythm. So what essentially, when we talk about insomnia, this is the definition of insomnia. Insomnia refers to the persistent difficulty with sleep that occurs over at least 1 month, despite having the adequate opportunity as well as the desire to do so. And it can refer to both initiating, which means trying to fall asleep, as well as maintaining, which means staying asleep. So Angie polled everyone early on, which do you have problems with? Both fall under the umbrella of really insomnia, actually. And coupled with this persistent difficulty with sleep, there is also a consequent sleep-related symptoms being experienced that produce distress, impaired social and occupational functioning. This simply refers to the drowsiness, the tiredness, the lack of concentration, and problems with like what I referred to just now with cognitive processes, emotional regulation. All these things produce problems for us in the daytime. So these must both go hand in hand together. If there's one without the other, we would explore with the patient a little bit more what your expectations are about sleep, right? Because it essentially should actually produce some real effects on our daytime functioning. So I want to really zoom in a bit more about insomnia on its own, what we used to use the term primary insomnia for. Primary in medical terms simply means that it exists on its own and is not caused by other things. So we went through a huge list of possible causes for insomnia just now. And when we find anything, we would say, oh, your insomnia may be due to something else. And that may be, so your insomnia may be secondary to illness, secondary to your medications, for example. But primary insomnia means, say you don't have any of those contributing factors and your insomnia just occurs on its own. We call that primary insomnia. We used to think that there was no cause. We couldn't find a cause. Primary insomnia, it just exists and we don't know why it's there. But in recent times, we are starting to see this term psychophysiological. Basically psychophysiological just means that there are some psychological as well as environmental and physiological, the internal factors that are actually producing these insomnia symptoms. And what we realize are some of these factors, these three areas, sometimes actually combine and when these issues happen, it produces a person who just struggles to sleep, even if there's no other conditions. We sometimes see, we look at predisposing factors, the factors that exist already that kind of predispose you to insomnia, and these would be personal risk factors, for example, like an anxious personality. Someone who generally at baseline tends to experience a lot of anxiety, tension in their day-to-day life, would be very prone to worry and overthinking, and therefore develop insomnia. Added on to that, maybe what we call precipitating events. So an anxious person may be able to sleep in the long term. So for most of the time, they can sleep. But once something happens, a precipitating event, a trigger event happens, then that tips them over into sleeplessness. And these things can be, serious events like trauma, negative life events like illness, legal troubles, financial troubles, but they can also be very normal day-to-day events like pregnancy, right? That's a major change, like moving house, changing job, getting a promotion, preparing a talk on sleep to the public, for example. These are very common day-to-day experiences, and sometimes also can produce a significant sleep in people. But what happens in people who develop long-term sleep problems is that on top of that trigger event, there are also perpetuating factors. That means traits that exist that cause us to for the sleeplessness to continue on in the long term. And that usually happens when we start picking up a bit of wrong concepts or habits, maladaptive and sleep disruptive habits towards our sleep. Things like watching the clock all the time, or we are spending a lot of time in bed just tossing and turning, getting very frustrated and distressed, what we call languishing in bed, right? Oh, I can't sleep. So a lot of these habits actually then feed into the insomnia and create a chronic insomnia that actually lasts a long time. Without some of these perpetuating factors, maybe the event would make us, sleepless for a few days, at most, and then we would get over it. But it perpetuates because of certain things that we start doing around our sleep. And to explore a little bit more into these perpetuating factors is this idea that of what happens actually in our minds when we start being unable to sleep. And we use the term cognitive arousal to refer to this, where the process of our mind starting to become racing. We start developing a lot of ruminations. We can't, a lot of patients who can't sleep tell me, I just can't switch off. My mind is so active at night. My body is so tired. I'm so fatigued from a busy day, a long day, but I just can't switch off my mind. And that's where cognitive arousal happens. And it really interferes with automatic sleep. Because what happens in sleep is that, we really need to approach it naturally. It happens automatically. And no one in human history has ever been able to control when they fall asleep. Okay, so when we start being hyper vigilant about our sleep, we develop a very selective attention to when we are falling asleep. We are constantly monitoring, oh, am I asleep yet? Am I asleep yet? And you're lying in bed thinking, oh no, I'm not asleep yet. And you start watching the clock, right? It's 12:30 already, it's 2 o'clock, it's 3 o'clock, and I still can't sleep. And according and because you can't sleep, you develop a compensatory intention to fall asleep. You keep telling yourself, I must fall asleep, otherwise I cannot function tomorrow. Oh no, I still can't fall asleep. It's 3 o'clock already. This is terrible. This is horrible. I can't believe this is happening to me. There's a lot of that process internally going through our minds. And there is also a lot of counterproductive sleep effort. So people who can't sleep and are very overly concerned about their sleep, they end up trying too hard to sleep. They're trying to force themselves to sleep. I don't know if anyone has done that before, but you will realize that it's counterproductive. The more you force yourself, the worse your sleep gets. And essentially, you return to the first step, where it becomes a vicious cycle. The more you can't fall asleep, the more you want to fall asleep. And the more you force yourself to fall asleep, the more you can't fall asleep. So it becomes a very, very negative, vicious cycle that a lot of patients with insomnia actually develop. And the thing to realize is that, how do we actually fall asleep? Good sleepers fall asleep without effort. And most people who have insomnia, they long for the day that they used to be, I used to be able to fall asleep without any issues, right? And they try to achieve that, but the more they try to hold on, the more it slips through their fingers. So that's the frustration with chronic insomniacs. And fundamentally, the underpinning to all this is the understanding that, really the occasional nights or even short periods of sleeplessness are normal. How do we adjust our expectations and our perspective about our sleep is very important in the process of managing insomnia, which is what we will get to next. I'm going to go through actually how we treat insomnia. And essentially, it's a combination of two approaches and two strategies. And very commonly, I'll talk about medication use first. And very commonly, people come to psychiatry thinking that, I'm seeing a psychiatrist means I must need medication for sleep already, when that actually is not very true. The thing to understand about medication use is that it gives very quick relief. That's the one of the good things about medication. It's quick, it's fast, it works almost immediately once you take the medication. But unfortunately, it gives very short-term benefits as well, and it comes with a lot of downsides. So the downsides include things like tolerance to the medication. That is one of the key problems with sleep medications. I always tell patients that there is no perfect sleeping pill. Unfortunately, that is the state of where our medication options are. There really is no perfect sleeping pill that you can take that works fast, that gives you a natural and restful night of sleep, and your body will not develop tolerance and dependence too. So unfortunately, there's no such thing. There are always trade-offs in terms of taking medication. That's the first thing I always impress upon people who I'm treating, and that we use medication judiciously and in appropriate way to complement other things. And the other things really is a main focus of behavioral strategies. That means the key is not using medication. Medication is a complement. The main strategy of treating insomnia is actually more behavioral. Behavioral strategies, unfortunately, take more time and effort to learn and implement. So it really goes back to what we were talking about your psychological processes and your behaviors around sleep. But it really, if you get those right, really, if you do practice consistently, if you get those right, you follow the advice of what to do, actually translates into very significant long-term benefits. And it's the only way actually that you can even hope to achieve good and natural sleep again. Okay, so examples of behavioral strategies would be things like sleep hygiene and stimulus control, which I will cover in the next slide. Sleep restriction therapy as well. That's a way of kind of calibrating your sleep timing. So these involve your changes to the lifestyle. And of course, there are a lot of psychological strategies working with the mind through either mindfulness practice, progressive muscle relaxation practices, or cognitive restructuring, CBT. So these are psychological strategies that address what's going on in the mind. We want to curtail the cognitive arousal that happens, when our mind is too overactive. When we put this in place, this forms the mainstay of a lot of treatment. When we put this in place, then we can consider adding on some supplementary medication in the short term to ease the process of you actually getting adequate rest, because we do know it's very difficult to function if you're not getting enough sleep. So you do need some short-term help. And that's where this list of medication comes in. It's a little bit like a ladder. We don't actually very often start with the strong sleeping pills. So you don't automatically think that sleeping pills are my only option. There's a huge range of actually medications that we will consider according to your circumstances to prescribe. And it starts generally with melatonin. That's one of the neurochemicals that we produce naturally in the body, and it regulates our circadian cycle. We can produce this as a pill and as a supplement, and it's sold as a supplement, which means you don't need a prescription. You can purchase this at the pharmacy as a bottle. And this is very good and it's meant generally for people who suffer from jet lag, for example, or for shift workers who just need a bit of help to recalibrate their circadian cycles. But in the occasional one-off, sleepless night, melatonin sometimes can give just that little bit of a boost. So this is quite a safe and appropriate option. You can sometimes buy antihistamines off the shelf as well. You may have seen Taxidom in some pharmacies. Antihistamines essentially are medications that most people take for flu symptoms. If you have a runny nose or if you have a rash and an itch, generalized itchiness, you will take antihistamines for its anti-itch and anti-rhinitis, runny nose kind of symptoms. And antihistamines, we use them sometimes because some of the older antihistamines are very drowsy. They're very sedating. We use them as a sleep aid as well. They don't constitute a sleeping pill. And generally, the risk of dependence on this medication is also generally lower. So we don't give Paxidom. Paxidom is off the shelf. We give another one called Atarax or hydroxyzine. Sometimes we use that, especially in younger patients who are less prone to side effects. The next tier or the next option that we will consider very commonly is actually antidepressants. We don't in patients with insomnia but don't have depression, we will still consider antidepressant use because they can sometimes be sedating medications that are safe to be taken in the long term and can help to aid in a person's sleep as well. So antidepressants are valid option to use. Sometimes I will also give a bit of antidepressants if I detect that there's a level of anxiety that we need to help to bring under control. So especially in patients with mood or anxiety problems, antidepressants are a very strong choice of medications. And finally, the last line in a sense of defense would be what we call the hypnotics, or really the pure sleeping pills. These would be things like Valium, Xanax, and Stilnox. These medications are where all the risk of dependence and addiction happen, which is why MOH guidelines to these medications restricts prescription by GPs to at most, I believe it's 14 days. And the GPs and polyclinic will not prescribe these medications to you in any excess of that duration. Most will give only maybe 1 week or 10 days of these medications. If you still can't overcome the insomnia with a short course, then really it's off to the psychiatric clinic to get. In very select cases, we will use these medications in the long term, but we really most of us actually try our level best not to end up using this. And interestingly, in my own experience in treating general psychiatry patients, if I start off strong with the behavioral strategies, if I really take the time to counsel and encourage patients to really consistently put into place some of these modifications and psychological strategies, I really do get away without resorting to the strong sleeping medication. So it is very possible. And the key here is really a combination of different strategies, really is what works best. Okay. All right, so the last few slides are really tips on how do we improve our sleep. What are some good sleep habits, good sleep hygiene, and what should we avoid to actually improve our sleep? And a lot of this Some of it is quite common sense. Some of it sometimes can be a bit counterintuitive. So in my experience, a lot of people resort to poor habits when they can't sleep, and it ends up worsening their sleep. And one thing, I think the most key important thing is to establish and maintain a regular morning wake time. Why is this important? Is because, as I pointed out just now, no one has ever been successful at controlling and controlling the moment that you fall asleep. You can't fall asleep at will, but you can wake up, right? You can set an alarm and you can determine the time that you want to wake up at. And this is the best way to make sure that you are able to sleep early enough, because what you're doing is you're curtailing your daytime sleep. Now, this must be accompanied together with avoiding sleeping in the daytime. So what you're doing essentially in the short term, if for someone who can't sleep and is complaining of insomnia, they will counterintuitively think, oh, since I can't sleep at night, I'm going to try to make up for it as much as possible. And they will delay their waking up time. They will languish in bed in the morning. They will start napping in the daytime to kind of make up for it. But why it's counterintuitive is because the more you sleep in the daytime, the worse your nighttime sleep is going to get. Then they'll tell me, oh, doc, I can't function in the daytime. And I will be very realistic to tell them, yes, in the short term, if you're already not sleeping early enough, in the short term, if you wake up early and don't and avoid sleeping in the daytime, you will be sleep deprived for a period of time. But that is actually the process, the sleep restriction process of how do you move all the sleep time to the nighttime. Okay, and that's where remember the homeostasis of sleep, right? The sleep drive. You want to force your body to relearn that actually nighttime is for sleep. Daytime is not for sleep. Daytime is for activity. Nighttime is for sleep. If you really must have a nap in the daytime to replenish your energy, the advice is really to restrict your nap to at most 10 to 20 minutes, no longer than 20 minutes. A short nap in the middle of the day can be quite energizing. It can replenish your energy and help you function well enough for the rest of the afternoon that you must perform for. And that short nap should not affect your nighttime sleep too much. So making sure you stick, and one thing is that once if a person starts suffering from insomnia, it's all the more important that you cannot take your sleep hours for granted anymore. So no more late nights, as much as possible. You really need to prioritize your sleep. Make sure you have a routine in place before bedtime, and then set your waking up time. And on the weekends, a lot of people are tempted to sleep in on the weekends. I want to make up for it. Our advice, no more than an hour or two extra on the weekends, because if you're changing too regularly, then that really disrupts your body clock as well. Another thing, use the bed only for sleep or sex. That's another that's another thing that's often taken for granted. If you ask people what do they do in bed, or I'm reading is the least of it. I'm surfing, I'm looking at my phone, I'm watching videos, I'm watching TV, I'm looking at social media, I'm doing work in bed, and all these things are really constitute poor sleep habits. Your brain is associating the bed with lots of other actually cognitively stimulating things. So that's not really ideal. The fourth point, go to bed only when sleepy. That really avoids you making the connection with bed as somewhere where you're frustrated, you're tossing and turning, you're wondering why you cannot sleep. So a lot of that actually is a very negative reinforcement of when you're being in bed, you're just feeling frustrated and distressed. So the advice really is if you're unable to sleep after going to bed, or if you're unable to go back to sleep after you wake up in the middle of the night, within 20 minutes, you should try to get out of bed, engage in something relaxing, listen to a little bit of music, do a bit of very light reading out of bed, or something like that, until you feel tired again, and then return to bed. So the bed should be a place that's associated with drowsiness, with tiredness, with sleep, and those are what we need to do. Another suggestion to really to help with your daytime wakefulness also is to expose yourself to bright light when you're awake. So the circadian cycle as well as the neurochemicals, melatonin, cortisol, these things are very much in sync with external stimuli, especially light, sunlight, bright light, for example. So for shift workers, part of the advice is that if you are waking up for a late shift, for example, you may want to expose yourself to bright light after waking, and that triggers cortisol release, and you get started and you're more wakeful. Your work area, if you're at night, should be brightly lit, and well, kind of bright, so that you can function. And when you are knocking off work, for example, if it's in daytime hours that you knock off work, you are preparing yourself to go to sleep. When you return home, you may want to lower the light exposure. Use sunglasses, for example, wrap around glasses, wear a visor and things like that. You want to reduce your light exposure. So bright light is another trigger for the circadian rhythm. Also, I covered already, avoid nicotine, caffeine, energy drinks, tea, and alcohol. Generally speaking, how long, what time should be our last kind of drink of coffee or last smoke? The advice generally is about 6 to 8 hours, actually, in best of circumstances. Of course, best is don't drink and don't smoke and don't take coffee. So, but that is sometimes not realistic. So in patients who are long-time smokers or who have habits of drinking coffee, the advice is really your last puff should be 8 hours before sleep. Your last coffee should be, I usually say, at most afternoon. Morning drink generally is okay. At most lunchtime. After that, you should no more caffeine or anything like that. And alcohol definitely should be a no-no. The smoking thing is especially hard for a lot of people. A lot of people actually tend to wake up to smoke when they can't sleep, and that's really a big no-no. So that's something that needs to change. The nighttime routine is especially important. So oftentimes in the process of assessing a person who has insomnia, I don't only focus on what happens when they get in bed. Really, what happens before that is especially important. I'll ask, what time do you have dinner? What is your usual routine leading up to bedtime? What time do you turn off the lights? What time do you get into bed? How long do you take to fall asleep? So these are very common questions we assess. And a lot of times people are not very disciplined in terms of this. They are doing things like the exposure to screen time especially is a big problem these days. They are using the phone actually most of the time in bed. Sometimes they will turn off the lights after dinner, then they will use the phone in bed watching movies or videos or surfing social media all the way until they doze off, right? And then they ask me why I can't sleep, in 2 hours or 3 hours and all these things. So a lot of these changes need to be put in place. Various things people have tried, getting a warm drink like milk, aromatherapy, light control, sound control, temperature control. All this is very important actually. Setting the right environment for sleep. Do really what works for you. Different people respond to different things. There are all sorts of environmental kind of adjustments we can make to make the sleep environment conducive. And definitely, if you're in bed already, no clock watching. Don't wake up and use a phone in the middle of the night. I'm guilty of that myself, but it's something that we should really try to avoid. Okay, and the last two slides really is from a psychological approach. What are some things that we try to help people manage that overactive mind? Because it must be done together with the lifestyle changes, because you can do everything right, in terms of your habits surrounding sleep. But when you go to sleep and you can't manage that cognitive arousal, the overactive mind, you are still not going to be able to sleep. And this is where we need to develop a bit more awareness. Firstly, to realize what's going on inside our mind when we are trying to fall asleep. And unfortunately, this is a key area I'm realizing in a lot of people I meet, is that because we go through our day so much distracted, we are so occupied with everything, we are not really paying attention to what's going on in our mind, and it's really on autopilot most of the day. When we go to bed, that's the only moment in the day when we are quiet and we are alone with our thoughts. And when that happens, then everything comes rushing in, everything starts replaying and we start imagining the worst of the future. So some of these, the awareness of the mind is one part of it. Identifying distorted thoughts and our distorted expectations and feelings towards our sleep is also important. Am I developing, do I find myself questioning, oh, will I be able to sleep tonight? Do you approach bedtime with a lot of concern and trepidation, or you do worry that I must take medication, I will never sleep without it, or do you worry that I don't know whether I'm going to be able to sleep tonight, I won't be able to function if I do not get a full 8 hours of sleep? And these are ideas that set us up for disappointment. It just keeps running through our mind. We ruminate about these problems at night, and it really keeps us up. So first step is really being aware of what's running through our mind, identifying the presence of some of these difficult and negative thoughts, and learning to actually shift our perspective or modify our kind of approach to some of these thoughts and replace them with a bit more adaptive beliefs and attitudes. Sometimes relaxation techniques have a role to play. We take our mind off things, helps the body relax, but really it's developing better understanding of our sleep, learning to trust the body to sleep naturally again, understanding that I even if I don't get 8 hours of sleep, I will still get by, and it's not the end of the world. And a lot of these ideas that even if I don't sleep, I can still rest in bed, I can still get enough rest, and things like that are very, very important in changing actually the approach to sleep. And it's actually how we reduce a lot of the cognitive arousal. And a good resource in terms of guiding people in this is this app, CBTI Coach. CBT stands for Cognitive Behavioral Therapy, and I stands for Insomnia. So this app was created by the US Department of Veteran Affairs to help people in their sleep specifically. And there are some guided exercises and explanations of what we can do to manage some of these distorted thoughts. And very finally, I want to talk a little bit about mindfulness. And in my own experience and in practice, I have found being able to be mindful has had very, very direct benefits on sleep, actually, because all through the last few slides, I've been talking about the overactive mind. If we're overly distracted, we are not paying attention to actually what is going on in our mind, then really we are not, we're just allowing the monkey mind to just run amok in our minds. And being mindful, being able to practice how to regulate our attention is the first step in helping us intentionally redirect away from a lot of rumination or excessive attention and focus on sleep. And some of the basic practices include bringing back the attention to sensations of the body. And this is where we take the mind off all the thought processes, and we are really listening in on the body. Where is the tension? Where is the discomfort? And the breath. Each breath, in breath and out breath, is just so much so in the present. How do we use that to our benefit in aiding our sleep? And really, a lot of people think that meditation or mindfulness practice is about emptying the mind, is about relaxation. But actually, mindfulness practice is not really about relaxation. Relaxation is a side effect of mindfulness. It's a very common side effect, but it's not the aim of it. All right, so that's not the aim, but it still is very good. And it doesn't matter. A lot of people worry, a lot of people ask this in class, oh, if I'm mindful in bed, if I'm doing the body scan and I fall asleep, is that bad, and all that? But it really isn't. And if you are practicing mindfulness for sleep, the intention you set in your practice is to help you sleep, then by all means fall asleep, from the practice. And I think that is a perfectly legitimate objective to kind of do, especially if you're already struggling in bed. But the practice itself benefits the process of falling asleep. Okay, so the first part of mindfulness is attention regulation, but it's equally as important in establishing the right attitudes. How do we approach sleep? What are the perspectives and expectations we have of our body and our body's ability to sleep? Can we learn to be patient with the body, be non-judgmental of what the mind is doing, and non-striving? Don't struggle to sleep. Stop that struggle. How do we put an end to that struggle and let things happen naturally? On top of that is, like I mentioned, developing awareness of what the mind is doing in order to correct some of the cognitions. And I found in terms of mindfulness practice, is fully compatible and complementary with cognitive approaches. That means what you learn in terms of replacing negative thoughts, working with your thought processes and your habits, is absolutely complementary with mindfulness practice of regulating attention and practicing positive attitudes. So mindfulness itself the practice itself can benefit your sleep, but there are also very indirect benefits. Because mindfulness does help us with stress reduction, it has benefits on pain management as well, especially people who struggle with chronic pain. It's very important to approach our pain in the right way and with the right approach. And how do we manage our pain in such a way that it doesn't affect our sleep anymore? So, I'm sure most of you are aware already, but Brahm Centre has lots of great resources in terms of helping people in their mindfulness practice. So the link is up in the top right corner, and that's the picture just shows the schedule of activities that are available. So from mindfulness foundation courses to the MBSR and as well as the MBCT are all very valid choices in terms of learning to go one step further in our mindfulness practice. All right. So with that, I have taken up just 1 hour, and I will leave it to Angie now to now bring us through, I think, body scan practice.
Thank you very much, Dr. Darryl Tan. That was a fabulous talk. It's so informative and complete. Nevertheless, there are still questions, about 21 of them that are waiting for you. But thank you for inviting me to conduct a body scan practice now. I have also sent the link over chat that people can use the free audio track to follow in the evenings. And as some people have said, many people sleep with me because they play the audio guide and then it helps them to just slip into sleep. So give it a shot. All right, so I'm going to now lead you in this practice. First and foremost, as you have all been seated for a long time, if you haven't been standing up, is to just give yourself a nice stretch. Yeah, and rotate your head like what Dr. Darryl Tan is doing right now. In 2 directions, and do it slowly and gently. Rotate your shoulders. Changing direction as well. So listen to your body, what your body needs, like even turning and stretching the back. Good. So before you go to sleep, some light stretching of this sort helps your body to relax, as they may have become very stiff and tense, especially if you have had difficult moments in the day, and that tension that built up in your body just continued to stay. So now just closing your eyes very gently. Check that your feet are both grounded on the floor. You can place your hands on the lap. Check that your back is slightly upright without being stiff. And if you're lying down, just check that your body is straight, that your spine is straight, your legs and your head are all aligned in one straight line. And let's just start with 3 beautiful deep breaths. This is just going to be a short body scan practice. Feel the breath in your body. And after the 3 deep breaths, just allow the body to continue breathing in a normal way. You're only observing the body breathing. You don't need to do the breathing for the body. I'd just like to invite you now to just sense your entire body from head down to the face, the neck, the chest, abdomen, down your legs to your feet, and wriggle your toes across the chest, down your arms, into your forearms, the wrists, and the hands. So we're starting this just to have the awareness of the body. And it's also a good way to check if the body is relaxed or there's any tension. And now we're going to drop our attention to our feet and just sensing the presence of our feet. You can move your toes, your ankles, and just sensing the presence of both your feet right at the tip of your legs. And very slowly scan up your legs, sensing the presence of your lower part of the legs, your knees, your thighs, and noticing the bum seated on the chair, and that your body is evenly distributed in weight between the 2 sides of the bum. And then scanning up your back, starting with the lower back and walking up the spine. And relaxing both sides of the spine. There are muscles along the spine. And when you have reached the shoulders, gently relax the shoulder blades, the top of the shoulders. If there's still tightness in the shoulders, very gently rotate them. Now slide down your arms, sensing into your biceps and triceps. The elbows, and your entire forearms. And noticing your hands and your fingers, relaxing your fingers. And shifting your focus now to your abdomen. And noticing the gentle movement in your abdomen as your body is breathing. Relax the abdomen. And expanding your focus now to your chest. And noticing the movement in your chest with the rise and fall of the rib cage. And scanning up your neck. Feel free to move your head side to side or front and back if you notice any tightness in the neck. And scanning up your face, starting from the jaw, the lips, cheeks, the eyes, across the forehead, and all over your scalp. And now just dropping into your breath, wherever you feel your breath is present. If you find that your mind is still jumping around at night when you do this practice, you may use your finger and tap on the bed and just following or sensing into the finger moving. And the movement will somehow coincide with your breath. And just keep that focus on your finger tapping on the bed. And for now, focusing on 3 more beautiful breaths. And open your eyes. Okay.